on. So sometimes the timing gets a little bit complicated, but I just want to share with you guys. And then once I share all of the activities, which it's quite a few things that we're working on for this year, I'll be happy to stop and take feedback, or if folks have suggestions of things that we, would need to consider, whether that be for this year or for planning for next year. So the waiver related activities that we are working on, I get questions a lot. Do you still have a long-term goal to shift to a single waiver? And we do, but what we want to do is really kind of build our infrastructure first. There's a lot of complicating factors with going to a single waiver, including what we call resource allocation. So we're continuing to work on a lot of these things that will still ultimately lead us to having a single waiver, but we have to get some of these things done before we can even then have a timeline for when we will do the single waiver. So we've worked a lot on vocational services updates. We have made some changes, and we still do have some changes. We want to, in vocational, have things like continue our virtual day habilitation, small group community activities, so that, those things that don't require going to a facility, but people can bill for. We're looking at that. And we do continue to look at aligning all of the services and the definitions and the rates across our new opportunities waiver, residential options waiver, and supports waiver. So we're still working towards making those things happen this year. I'll also talk a bit more, it's a whole agenda item, so I'll talk a bit more about waiver changes that based on lessons learned from the public health emergency and the things that we've had in place in Appendix K. But this year we do plan to have waiver amendments completed and in place by the end of June, so that they will be in place before July 1. So I'll share more about that when we get to that agenda item. We've also been working with Medicaid, and that's actually in the budget discussion as well, to add dental services for adults with IDD in our home and community-based waivers. So we'll share more about that. And then we are also now working on an infrastructure for remote supports. Remote supports is something that we've learned has been extremely effective in other states. First and foremost, it's been effective for the consumers of services, because if you don't need a staff there to help you, bathe or get dressed or things like that, but you have a need for some level of assistance for other things, they have had some great outcomes for people using remote supports. We also know then it sort of shifts the need for as many direct support workers. So it indirectly has an impact as well on the workforce crisis, which we know is evident here in Louisiana as well as other places. So this year we want to just start building what that remote support program would look like. And then, as I mentioned earlier, in order for us to get to the consolidated waiver, we have to do a different type of assessment. We used to use the supports intensity scale, and based on feedback, we know that that's not effective. So we have been working for several years now to build our own tool that is called the Louisiana Plus. And the Louisiana Plus is the assessment, and then it leads into an electronic plan of care. So we've come to call that the EISP process. This will build in lots of different things. And so we are continuing to do work on that. We've nearly completed the first piece of the assessment. So what we will be doing this year is piloting the assessment, piloting how we get to tiers and things like that with different provider groups, support coordination agencies, and families. So for this year, our hope is that we get to be able to pilot that. So those are primarily our waiver related activities. Our children specific activities are, we do have in early steps a statewide systemic improvement plan, and we have certain activities we're taking there, which we will continue to work on. We do have a role in TEFRA, and we have another update on TEFRA later on as well, but we are engaging in the OCDD activities related to TEFRA, and also kind of working on communications with our early steps families as it relates to the rollout of TEFRA. In regards to stakeholder engagement, there was a request from DD Council that we do some presentations on certain topics. And so we were hoping to start October 1. Hurricane Ida had us a little bit delayed, but we do have one of our activities will be to do presentations every other month that are on the topics that are given to us as recommended by the DD Council and the Executive Committee. And we're also working on a bigger outreach plan. We want to be able to make sure that the materials, first and foremost, the materials and resources we have are transparent and user-friendly for our advocates. But we also know that while there are a lot of very strong advocates who understand how to reach out to people and where to go, that there's still a lot of people out there that we don't reach and maybe don't know about our services. And so our outreach wants to also consider, how do we reach those people who maybe need to know about our services but are not aware of DD Council or Families Helping Families. And so we want to be able to think about outreach in lots of different ways. So we will have an entire outreach plan. We also have several capacity building activities. We were approved to be able to start work with what's called a START team. It's capital START. They are also have been in other states and have had a lot of success in working in other states. This team will come in and they will do an assessment of our state, and then which the assessment includes talking to stakeholders, talking to providers, identifying where the gaps are, and then working with us on how best in our state to develop kind of like a therapeutic respite or a way that we can help people with co-occurring developmental disabilities and significant behavioral health needs that go into crisis, and what are ways that we can best address that. So this year, we do hope to have them engaged to do that assessment, to begin talking with stakeholders, and to begin helping us develop what that plan looks like. The true implementation will depend on some other factors and what we find and what takes place. But this year, we do at least hope to have the assessment done and our plan of action for what we're going to do to address those needs. We have some training and technical assistance to support coordinators and to our provider agencies that are related to wellness, especially for those people who are high risk. We also have some other partnerships that we have right now with our managed care organization, behavioral health leads, and our hospitals, so that we can help to start to collaborate with them on addressing the needs of people with co-occurring IDD and behavioral health needs. We also have been collaborating with our OCDD dental task force, connected us with LSU School of Dentistry. And so we've been doing collaboration with the LSU School of Dentistry. They have a curriculum, but we want to work with them to look at that curriculum and see if there are things that we can incorporate that might better help them be positioned when they get out of school to provide dental services to people specifically with cognitive disabilities and sensory needs and things that they need to consider to be able to get those dental services. So we will continue that collaboration throughout this year. And then we are also looking at we've talked before about the value-based payment model. We got off track on that with COVID because the metrics we identified, they were no longer appropriate, I guess, based on COVID, because we can't look at going in the community and things like that. At least we couldn't under COVID, or that just looks different now. So we are having to go back and relook at our metrics and what we use. But for those of you who may not know what value-based payment model is that it's a way that we can pay providers and support coordinators for providing quality services. And so we are looking at that. In terms of our intermediate care facilities, we are looking at the role of our programmatic unit and how we assist with helping to develop quality in our intermediate care facilities, and we will continue that. There is, in terms of our state and federal regulations and things we're working on there, we are still working to come into compliance with our home and community-based settings rule. Again, COVID sort of impacted that as in terms of employment and things. But this year we're working to get back on track with working with our vocational providers to be able to bring our state into full compliance with those settings rules. We also have concerns by the Louisiana Legislative Auditor for our waiver services in terms of documentation. Their concern is documentation when we don't follow a person's plan of care in terms of the hours that the person receives. And they've asked for several years now to make sure that if the individual or the family requests a change in the plan of care, that we fully document that, so that, let's say a person is scheduled for 8 hours, they only get 6 hours. They need to know what happened in those 2 hours, and they want to make sure that it was at the individual or family's request, and not that it was that we didn't have staff or something, for some reason it was the provider requested. And so we continue to work on ways that we can help show that, because again, in the audit, it comes up as inaccurate payments when we don't have that documentation. You guys may be aware that we had the Office of Inspector General come through. They spent about 2 or 3 years looking at what we had in place. They primarily checked the emergency room and hospital visits with our critical incident system, and they found that a lot of concerns when they went to look for that. So we are engaging in a lot of different things here to address their concerns. We are looking at our entire incident management process, including our policies and procedures and training, and we will be making updates to that. We are also looking at, for those of you that are in waiver, there's a certain section called rights and responsibilities. We are taking a look at that and what modifications might need to happen with rights and responsibilities. And then we'll have training for everyone in terms of any of those changes that we make. And again, we will also then build in our own tracking and monitoring mechanism so that we can make sure critical incidents are being reported as best we can, using something similar to what the OIG did to make sure that we catch it and we don't need the OIG coming in to try to catch it. So a lot of work being done there. Some folks on the call now are on a part of our HCR 45. In the 2021 session, they asked that we engage a group of folks to look at tracking mechanisms. It's totally voluntary, but a tracking mechanism for folks who may have high risk behavior or elopement concerns. And so we've had a group of stakeholders looking at that, looking at the feasibility of that. At first, I think a lot of folks were concerned because it kind of sounded like, oh, wait, are you talking about putting ankle monitors on people? But that's not what it is. It's actually something that helps with risk and maybe even help somebody be a little more independent in terms of the way that we use it. So we've got a team of folks. There's a report due to the legislature in February. And we are on track to get that report. We can by all means share that with DD Council if that's something that you guys would be interested in. In addition to those things, OCDD is working on some internal processes that are internal just to our office and how we operate. We have lost some positions over the last few years. And so we need to really take a look at how we're structured and make sure that we are operating as efficiently as possible so that we can be as responsive as possible to the public and to the need for changes. And then OCDD is working within the larger LDH. There will be coming out very soon a Louisiana Department of Health business plan. And so OCDD works with, there's some initiatives there's a lot of initiatives we're sort of indirectly involved in, but some of the ones that we are directly involved in, there are initiatives to help address the direct support workforce. And so we'll be doing some work with the Louisiana Workforce Commission in terms of trying to make sure that they have a good definition of a direct support worker, so that there's some things that can happen if they are considered in crisis. And so we have some work that we want to do with the Workforce Commission there. And we also want to do some focus work or some focus groups where we want to go talk to direct support workers. We want to talk to direct support workers who've done this for 25 years, and we want to talk to some who've done it for a year or two. We want to find out from them, what motivates you to be a direct support worker? What motivated you to start? What motivates you to continue, especially those long-term ones? Because we know that rate of pay is critical, but we also know that there may be other things that we also need to consider. And so we want to start engaging some focus groups with those direct support workers directly. So that'll give us information about other things we may need to do. We also have a team in OCD that's working on health equity and considerations for health equity things across our office. And then we're working with Medicaid. I don't have a lot of details on this because it's very early on, but there will be some rate reviews that are done. And we do anticipate in this year having some additional conversations about the rate reviews. So that was a whole lot of information, but I will stop there and see if folks have any, feedback on those initiatives, or specifically if there's anything that, we might have missed that you guys would like to see our office work on in the upcoming year.
Julie, I have a question. This is the first time I'm ever hearing about a consolidated waiver. How long has this been in the works, and what is it about?
Sure. So it's been in the works for probably close to 5 years now, maybe even longer, because my sense of timing, I don't know about you guys, but like with COVID, it feels like a whole year and a half passed, and I'm like, wait, that was yesterday. And then Ida was like, wait, we're in what month are we in? But it was about five or maybe even 6 years ago now. We had pulled together at that point a large stakeholder group to look at what changes we needed to make in our waiver. And it narrowed down to two major things. One, they said, we want you to end the waiting list. And after you end the waiting list, we then want you to move to a consolidated waiver. And so we first and foremost spent our efforts on shifting from first come, first serve to our prioritized waiver. And now that we've shifted our system in that way, sort of the next level, then people just said, when you have 4 waivers and you trying to navigate, and when you bump and when you like, that is just confusing. So if we just had one waiver where people might move up or down as they needed, they just felt like that would help the system work a lot better. So ultimately, that is still our goal, to get to a consolidated single waiver that's tiered. And so then if people, people's needs change over time. So they may change where I need more, or I may help folks get independent and they may need less. So it's a system where you can move to the tier that you need. So and so that's what we're kind of trying to do with our 4 waivers now, or make them the tiers that would ultimately then be transferred into the consolidated waiver.
Okay, thank you. Does anyone else have any questions?
Jill has her hand raised.
Jill, you have the floor.
And Miss Julie, you said something about providers having virtual visits. Like, I know with my company, like, I see how that, the way I'm looking at it is that kind of like more beneficial to the provider than to me, because like I'm looking at this, like especially my experience with my provider, I'm looking at this as, hey, we're short on staff. Like, so today she doesn't get a worker. Today she gets a virtual visit. And I see how y'all would introduce this to provider agencies, and they think, okay, let's staff more money, but how is this beneficial to me? Because I feel like I've been out of PCA for over a year and a half, and they have like no intention of like even introduce. I mean, thank God that like I have family, but in other support. But like, is this more like a way to for I don't want to say shady just then my bad. Or an agency to say, oh, we're short on staff, let's just have virtual visits. And how is this benefiting me as the consumer?
Okay. So with remote supports, I guess first let me make clear, a lot of that we're still in the process of developing, Jill. So we will need to consider all those things. But the way that it has worked in other states, it's not like here's a service that's available and provider, you tell us if you want a virtual remote support or an in-person support. It would just be an option. So when you go through your person-centered planning, that remote support may be something you, Jill, are not interested in. And so then that wouldn't be available. So it wouldn't be a way that we said, oh, well, if staff is not available, then let's do remote support. There are people where that remote supports make sense for, and there are people who absolutely remote supports does not make sense for. And so part of our development is who does it make sense for, where does it make sense? And, and again, it would just be one of the tools or resources that's available as the individual and their family develops the supports that's needed. So it would be there, again, only if it makes sense for you. And if it's not something that makes sense for you, then it wouldn't be something that would be discussed. But again, that's why we want to take our time as we build this, and we don't want to rush into it and get it in the waiver without having really vetted that. So we're putting together a team to really explore and research and make sure that we lay it out in the way that it needs to be laid out. So that's why this year is really just our exploring that. What's the equipment that we need? We do maybe have some funding available to us to purchase some of that equipment and upfront. So this year is really going to be about exploring all of those things and how we do it the right way here in Louisiana.
Okay, thank you. That was a great help.
I believe Matt has his hand raised.
Yeah, good morning, and thank you, Kim. Julie, just a brief comment and then one question. Just want to thank the office for the rate increase in the wage floor that was recently passed on October 1st. As a provider, of HCBS services, we're already seeing a noticeable difference with our ability to recruit quality direct service workers. We started on Sunday, September 26th, because of the way our payroll falls. So just a full thank you for that. And of course, that was all possible due to the advocacy of the DD Council, as well as the funds that were available in the trust fund. So just wanted to give you a situational awareness that we're already seeing a bump up in quality and ability to find staff. The next question I have, you mentioned the START survey or the START program that you guys are going to be, I guess, beginning. One of my concerns, and I don't know if this is statewide, but it's something I see, and it has been a concern of mine for well over a year, is that individuals that are coming out of group homes or ICFs, and when transitioning into HCBS services, are eligible for the ROW, the residential options waiver. And my concern is that waiver doesn't include supportive independent living, or SIL as people know it. And of course, it doesn't include night hours as well. And it's been my thought that that is a gap in services that are potentially keeping people from transitioning to the community. You think of money management, and I know we do money management onto the road too, but you think of all the services that are needed to live independently. So my question, sorry about the commentary, is will the START program sort of be looking at that kind of gap, and if so, thank you.
It's really looking more at gaps of treatment needs and services for people with intellectual and developmental disabilities in the behavioral health, and more along the lines of, kind of the crisis situation. That's more what it's focused on, and not necessarily on that. Where I would say we would capture that is when we start having our discussions on the rates and what goes into the rates, and that's part of the LDH business plan, is to be able to take a look at that. Matt, I would think those conversations would be more closely related to what we would do as we start to take a look at that, and all of the things that are included in the rate, all of the considerations that have to be given in the rate, and what goes into it, which we're still trying to kind of map out exactly what that's going to look at this year. But I know that there is discussion of needing to take a look at that in some fashion in this year. But we will definitely have more about that, but I would think that would fall into that category.
And Julie, just a quick follow-up. I don't want to take all your time. Would that be under the new waiver that's coming up? You mentioned that you're transitioning to another waiver, or is this just?
No, that's part of the infrastructure building for all of our waivers. In the business plan, there is a section that talks about the need to, and I don't have that specific language there, but it is, and Kelly may be able to help me there. It is that every Medicaid service, or all services in Medicaid, they want to be, we often hear from providers of all Medicaid services that there needs to be some way of looking at rate increases, looking at rates that make sense, looking at, keeping up with current, outside of Medicaid services or whatnot. So one of the things that was important to Secretary Phillips is that we build in a mechanism within the department that on at least a 3-year cycle, we look at all of the rates across the board. And so our Medicaid home and community-based services is one of them. So we have approximately 500 different rates across our 4 waivers. So we will have to build in kind of like, what does that review look like? But she has said that on a 3-year cycle, all Medicaid rates and services will get into a cycle, and every 3 years, so that if we do home and community-based this year, for example, then we will come up with that mechanism. We'll do a review, and then it will be reviewed again in 3 years. Because what we hear from people a lot is that, oh, you address the needs right now, but we're not building a sustainable system for the future. And so this allows us to have a mechanism and a requirement then that every 3 years, we're going to then take a look at that. And Kelly, I see you shaking your head, but please add or correct anything.
Yeah, well, but maybe I didn't ask my question or address my concern, because I look at my role on this DD Council of, ensuring that people have independence and are able to make choices. It's simply that the row is not comprehensive enough for someone trying to transition out of a group home. Okay. I mean, that is my concern, and I don't know if it's other people's concern. This is not a survey that I've done. It's just I think that you're looking at someone who has been receiving 24-hour, 365-day-a-year care. I see a group home or maybe even Pinecrest, perhaps, and then they're only being able to transition into the row, which doesn't include a supportive independent living piece. And my concern and what I'd like to see if it really is an issue, and I don't know if it is, but I feel like it is that parents, or particularly parents, are reluctant to transition an individual out of a group setting because the row is not robust enough in order to provide the necessary services for that individual to live independently. I hope that wasn't too long-winded, but
I will take that back. That fits into a couple of different things we're considering and thinking about. So I'll take that feedback back and see where we can incorporate that discussion.
Okay, are there any more questions for Julie? Crystal, you have the floor.
Hey, everybody. It's been a long time since I've been here. Thanks so much for being patient with me on my journey back. And I appreciate everybody reaching out and really being concerned about what happened, and I appreciate it. So when listening to Matt, Julie, I heard him say that he was really seeing some quality go up already with the rate increase. And my question is, are we doing anything to capture those quality measures to make sure that we are, that we can prove whenever we need to go back to legislators that this is the way that we need to be moving in the right direction, and that this is appropriate and what we need to be doing, so that those quality measures can prove that these outcomes are actually happening? Are we doing anything to capture that? Are we going to develop anything to capture that in the future?
Well, so there's a couple of different things there in terms of what we are capturing right now is turnover rates and retention. That doesn't necessarily get to quality, directly get to quality. It'll indirectly get to quality in that we can see, because we've taken some data that shows us our turnover rates. We've actually looked before COVID, during COVID, and now one of the things we will look at is after the rate increase, what does turnover look like? So we will be able to do that. One of the things that OCDD is going to be doing, and this kind of gets into the next bullet, but we started talking about budget, so I'll go. One of the things we are going to do associated with that rate increase, with the rate increase, there was a requirement that direct care staff be paid a minimum of $9 per hour. And so one of the other, and I only say that I think this is important, but I don't know that it really gets to quality, which you were asking me about, Crystal. We will be doing an audit to make sure that the providers are paying that $9 an hour. And during that audit, we'll kind of be looking at some other factors along the way. But to truly get to quality measures, so now does that mean that people are getting the outcomes that they need because they now can have their staff? Part of the problem we have is that we do not have a great way right now of capturing that in our system. And with the electronic ISP, the EISP that I was talking about earlier that we're looking to pilot, one of the things that we've said is critical that we build in is that we have a way that we can look at things. You know, everybody's got goals in their plans of care, but right now, in order for me to even go see are people meeting their goals, it would require me to pull all 13,000 plans of care individually, look for progress, make some notes. So I just don't have a way that I can capture that yet. It's been critical to our management team here in OCDD that we build in a way that I can see that, because we are spending more and more and more. If you look at the amount of money that's been spent on waiver services in the last 10 years, it's a straight line up. And people are starting to say, well, what are you getting for that? And so to your point, we do have some measures that people call quality measures. I don't personally think they're outcome measures though. And I do want to and do plan to build that into my system. And as we start to roll out this pilot of the EISP, we want to include some families too. And I want to hear from them so that we're making sure that we're capturing the right thing once we have a system that allows us to capture it. Does that make sense?
It does make sense. And I have a quick follow-up. I heard you say that you do right now capture the turnover rate before, after, and before, during, and after. Is that a report that
you cut out?
look at?
Is that a report that what?
We can get here for this
Sure.
group to take a look at?
Sure.
Does that need to be a motion? I'm sorry, Kim. I'm rusty at this.
That's a question for Brenton. I'm rusty also.
For right now, it doesn't necessarily have to be a motion. We can just say it's a committee decision, because it's something that the committee would decide on. A motion means the council would have to approve it, but since it's committee business, we can do it as a decision, as long as the department provides the report. If we move further along and the report isn't provided, then I would say you can consider a motion for the full council to debate.
Julie, could we see that report by the next meeting?
Like Thursday or by?
No. Sorry, the next,
January.
this
Yeah.
committee meeting.
Yeah, sure.
Okay, great. Doesn't sound like we need a motion then. Thanks, Julie.
Are there any
Brenton
questions?
always emails me ahead of some, so Brenton can help me remember.
I'll put it on my list. I was going to ask you if all the initiatives that you ran through, there were a lot. I didn't know if there was a place online that maybe it's listed, or if there's a document.
And actually I made a note of that. We're working on our external facing document right now. And I will have that up soon. I don't have it quite yet. We had it ready to go. And then when Hurricane Ida hit, some of the deliverables and objectives that we had planned got pushed back a little bit. So we needed time to rework it, but I should have that external document within the next week or two. And yes, it'll be on our OCDD website. And then what I do is at the end of every quarter, we do an assessment of where we are with the things that we plan to do in the quarter and give sort of status updates every quarter. I have an internal and an external document for that, but the external will definitely be some of the stuff y'all don't care about, what I'm doing to make my office better, those kind, what contracts and things, but the external document, by all means, we're going to like grade ourselves every quarter and continue to update it. So yes, we can make sure that's on the website. I can send you that link, Brenton, when we get it.
Yeah, that'd be great, because I'd like to link it in our committee summary just so they can go back and reference it. Because even I didn't catch everything in my notes. So it'll be great to look at that.
Okay.
Are there any more questions for Julie? If not, we'll move on to Kelly and a Medicaid update.
Well, I had a couple more things on the agenda, Kim, if that's
I'm
okay.
sorry.
That's okay.
But I think Jill Hano has her hand raised as well.
Jill, the floor is yours.
Okay, Julie, is all this in your October report? Like all these mentioned?
Most of it is, but actually one of the things that I've recently talked to my staff about and I want to do after this meeting, so it'll be there for the January meeting, is I may want to rework my report. And so I was going to ask Brenton or Amy or someone on the council staff, like what I need to do. I don't know that we're capturing things in the right way or the best way right now, and we're not capturing all of our major activities. So I do want to, for my January meeting, try to kind of like restructure the way that we're reporting so it may make more sense. Most of this is in there, but not all of it though, Jill.
I think I don't know, like, I thought I was paying attention, but I missed like everything.
That's okay.
But-
I'm gonna get that external. I talk fast and it's a lot.
All right.
Just
Thank you.
very quickly, and I'll turn it over to Kelly to do the to give you guys an update on Tefra and dental. But we've already talked some about the rate increase, so I wanted to share that with you guys. I did want to make sure everybody knew there is American Rescue Plan Act dollars. Though that in the American Rescue Plan Act, it did a lot of things. One of the pieces of the American Rescue Plan Act is that it allowed states to get an additional 10% federal match on the dollars that we spend on home and community-based services. We then have to take that money and put it back into home and community-based services. So with the CARES Act, we could draw down money, but then there was a lot of different things we could use it for. With this American Rescue Plan Act, it's dollars. The dollars that we can draw down on home and community-based have to then be reinvested into home and community-based services. And CMS requires that we give them a plan for how we would spend those dollars. We had an initial plan due in July, and we've recently sent an updated plan in October. A lot of the initiatives that I talked about, we have in our spending plan, but part of the issue is we can't spend any of the money in our proposed spending plan until CMS gives us approval on that. So and at this point of all of the things that we sent in July, the only thing we got approval on was to use some of the funding for implementation of Tefra. And so we will continue to update. I anticipate by the January meeting, Kelly, correct me if I'm wrong, but by the January meeting, we would know what CMS approved and could give a more detailed report, or we would hope that we would know what CMS approved so that we could give a more detailed report and then continue to update you guys. We will have to give quarterly updates to CMS all the way through March of 2024, which is how long we have to spend the money. But again, we're waiting for more there. And then the last thing that I had, and this should have gone to the council for everybody to know and have an opportunity. So we've heard when we did our new opportunities waiver renewal, we tried to put some things in place that from information we heard from stakeholders about lessons learned during COVID-19. But we know that there are still concerns out there in 3 primary areas that came up last legislative session. That is family members as paid caregivers, continuing to use virtual visits for some of the services that we have in our system, and the 16-hour rule and the requirement for staff not to work over 16 hours a day. We had proposals that we put, or we actually made changes in the new opportunities waiver for some of those, but we have heard from our stakeholder community that there continues to be more concerns. We know right now that our Appendix K exceptions will be in place until 6 months after the end of the public health emergency, which means we're good now until at least July. It could get extended again. We don't know that until every 90 days. But we are planning, and we will have our waiver amendments. We would like to have our waiver amendments to CMS by February, March at the latest for our waiver amendments to move forward. So that way we make sure they're in place by the 6 months after the end of the public health emergency. So in order to get to decisions that we need to on those 3 areas for what will be in the waivers, We are going to be holding focus groups. We will have 3 focus groups, one for each of those subjects. Next, there'll be 2 2-hour sessions. We're doing them from 4 to 6 in the afternoon to try to accommodate those individuals or families who want to participate but may have to work during the week. So that's when the sessions will be. We are asking if you register that you're able to check the dates and make sure you're able to be in both, because we are going to limit it to 25 people. So there's a registration form if you want to participate in the discussion. And we're going to try to make sure that we have a diverse representation. So people in urban and rural areas across all regions, self-advocates, family members of children with DD, family members of adults with DD, provider groups, LGE groups, support coordinators. So we're going to be looking and trying to but we felt like 25, if we get more than 25 people, then it makes it hard to really be a working group and like kind of vet things. And so we will have those and again, each 3 will be different sets. So that's 75 people who will participate. And then on November the 10th, we'll have those 3 focus groups. The first group, the first week, so next week, it will focus on us sharing with you guys all of the research we've done. So this is what was in place before COVID. These are all of the CMS regulations, federal regulations related to that. We've also done some research into other states and what other states are doing. So we'll be able to share that research. That'll probably be like the first hour, and then kind of share with you, this is our initial thoughts. That way for the next hour, we can then let's brainstorm, let's talk about it, let's see. Then we leave that group. OCDD will go do whatever homework we need to. We'll come back with that group for 2 hours the next time so that we can see, can we come to a compromise that works for everybody for how we're going to move forward in a way that we feel will meet CMS regulations. We then will have a meeting November the 10th. And at the November the 10th meeting, everybody and anybody who wants to participate will be invited. We will share the outcome, not only of those 3 focus groups, but our plan moving forward with every exception and flexibility that we have in place with our waiver. And people will have an opportunity to submit public comment, to submit concerns, to give us feedback in writing after that. After that November 10th meeting, after we've heard from everybody, our management team will take that. We will then move forward with getting our waiver amendments. So for those of you who don't know, it usually takes us a good 6 weeks to get the language, to get it circulated where it needs to then get it ready to go out for public comment. So we want to be able to get them out for public comment around January or February. There's a 30-day window for public comment. Our hope is that we've done our due diligence on our end to hear all public comment that we have ahead of time, so that then people's concerns will be addressed. So at the end of that 30-day period, we can get it to CMS well in advance of the end of the public health emergency, so that folks can hear. So I did want to make sure I had a chance to share that with you guys. And so for any of you, I believe DD Council sent out that information, but if not, I can definitely make sure we get that out today, so that people can see where to go to register.
Yes, we did put it out on our social media accounts. I know it was sent to our FHF directors and LACAN leaders to share with their groups. And it was also, I want to say it was sent out to the council members as well, but I'll go find the link and I'll put it in the chat in just a second as well.
All right. Are there any more questions for Julie? Jill, Hanno?
Okay, so I wrote in my, for the ARP, the 10% is the 10% federal match. And then you said something about, where is she? There she is. Then you said something about TEFRA. So are these ARP funds going directly to TEFRA?
I'm going to let Kelly cover that one, and I'm going to apologize, Kim. I am going to have to jump off in just a few minutes. I had a meeting added for 10:30 over the weekend. I can join back again if I'm able to, but Kelly can definitely cover those questions on TEFRA and the dental. I know there were some questions around that. So,
Crystal, was your question specifically for Julie, or can Kelly answer it?
I had two quick questions. Julie, I wanted to see if we could do, I know there's that visual work group going on right now, if TEFRA could be included in that so that when it comes out, people have a visual workflow that they can follow and see and know how to access TEFRA. And then my second question was, is Children's Choice going to be included in that paid caregiver group?
Yes, we are looking at when we have the discussion on family as paid caregiver, it is across all of our waivers. Yes. And I truly do apologize for having to jump off. If it wasn't a meeting Secretary Phillips scheduled, I would have had somebody else cover for me. So,
Well, thank you, Julie. And we'll see you Thursday.
okay.
And we'll turn it over to Kelly now with Act 421 and dental.
Hey, everybody. And Crystal, to answer your question on the visual workflow for TEFRA, that is something that we can share the workflow and make sure that everyone is comfortable and knows how to access those services. So I'll work with Julie and make sure that happens. So an update, shall I start with the update on TEFRA, or Jill had a question that we didn't get to answer? Was that right about Act 421 and or the TEFRA funds and the ARP, the rescue plan? Was that right?
Jill, Hanno? Did Julie answer your question, or would you like Kelly to elaborate?
Can you elaborate?
Absolutely. So I believe your question was, are the funds from the American Rescue Plan Act covering TEFRA? And the answer is partly yes. Some of those funds were approved by CMS to go toward our first year of TEFRA. But at the same time, we also have funds budgeted in our regular state budget. So it's a little bit of both.
Perfect. Thank you.
You're welcome. And so our update on shall we go to dental now? Or
Yes.
Okay. So the update on dental is Medicaid has been working very closely with OCDD to make sure that we're really putting comprehensive dental for adults on the OCDD waivers to make sure that we're doing this effectively. And so working with them closely regularly, as well as working with CMS to make sure that when we submit our waiver amendments that we don't have trouble with approvals. And so we have been in the draft process, and again, working with CMS on getting those waiver amendments drafted. And our plan will be to submit those amendments in the first part of January, early January, to CMS. And so that's where we are with dental. So working through that. Any questions about dental?
I don't see any.
Okay. Well, then the next update I have is on TEFRA. And you guys know, and it's been previously reported that we switched gears. So we're no longer pursuing the 1115 option. We are now putting that into our state plan. And again, working with CMS very carefully. And we submitted our TEFRA state plan in draft form to CMS just to make sure that they didn't have any questions, and they did not. And so the formal state plan has been now submitted to CMS and is under their review. And so they are aware of our anticipated start date of January 1. And so we continue to check with them on a weekly basis just to make sure that they don't have any additional questions and to make sure that they continue on their review so we can implement on time. Any questions about DEFRA?
Hey, this is Brenton. I just had a quick question, or more wondering if you could explain. I get we do have some members on this committee that may not have been a part of the Act 421 original stakeholder group. So I was wondering if you could briefly kind of explain the difference that, or the impact that it may have if we're going on with the state plan option as opposed to the waiver, just so some folks can have a background there of how important of a change at least our community thinks it is.
For sure. So with the waiver option, we would have had a limit, a waiting list. We anticipate we would have had a waiting list for those waiting for services through the 1115. But now with state plan, anyone who qualifies can be enrolled into this program. And so there's no limit to how many people will access the TEFRA service, and it'll be available to anyone who qualifies. So that is the difference.
Thanks for that. It's a very big change. I know that a lot of people were hoping to have that state plan option from the get-go. So I just want to make sure everyone was aware that that big change has happened or occurred.
Any more questions for Kelly? Crystal?
Hey, Kelly. I have a quick question for you. Is this still going to be, do you guys know yet if to access TEFRA, families are still going to have to go through their regional district and authority first for an intake appointment, or is it going to start with just going to Medicaid for approval?
I believe it will start with going to Medicaid for approval, but our human services districts will have to help us still with the screening process.
Okay, thank you.
You're welcome.
All right, it looks like there are no more questions. Thank you, Kelly. Now we can move on to our contractual activities. First on the agenda is Devika Rao available now, Brenton?
Yes, let me move her over to panelist.
Excellent. She's going to share a little bit about the video activity O'Neill Communications has been working on for the council.
Before we get started, can I ask Brendan a quick question?
Yes.
I think you're muted, Jill.
One moment, Devika.
Okay, can y'all hear me?
Yes.
I'm sorry, y'all. This action plan I have says FY21, but it has it says the progress is to June 30th, 21, but the heading says 21, but all the information is, I skimmed through it, and all the information seems to be up to date from July to now. So I don't know, there wasn't a question, but we are in is this a typo, or And aren't we in FFY action? Aren't we now in our 22 plan?
Right. So
The first year I was able to keep up with it, and I was so excited, and then it was not what I was expecting. But
right,
please,
it's okay. It gets a little confusing. So your fiscal year 22, you are correct. It starts October 1st. And so all of our council meetings, when we do our quarterly updates, it's going to be the previous quarter. So from our last meeting to this current meeting. So the updates will still fall within the fiscal year 21 updates. So stuff that occurred at the end of our fiscal year 21. So starting in January, you'll start getting updates that happened over our first quarter of fiscal year 22, which will be from October 1 until the end of December. Does that help? So it's not a typo. It is still the FY21.
Attention to that.
I know it can be a little confusing. And then also some of our initiatives fall under a state fiscal year, which is a different time plan than our federal fiscal year. So I appreciate the question. It can be a little confusing at times.
I've been focused, well, you of all people know, I've been focused on the contractual updates. So when we get to emergency preparedness, I am not looking for activity 2.2.2. I am still looking at activity 2.74.
That is correct. Yeah. So it should be
Okay.
the 2.7.4 in the status of planned activities. But our action plan that's going to start as of October 1, those activity numbers will change, and you'll see that reflected in this committee's
January.
agenda in January. Correct.
Gotcha.
Yeah.
Thank you so
You're welcome.
much.
No problem.
Thanks for asking that question, Jill. I'm sure a lot of people were confused. All right, Devika, sorry about that. Are you ready? to give your
I'm
report?
sorry.
No, you're good, Jill.
Oh, please don't apologize. Good questions, good conversation.
All right, the floor is yours.
Okay, and Brendan, if there's anything specific you want me to cover, I'm happy to do that. I'm just going to kind of go through the entire webinar series and kind of our findings at the end. And then I can open up to questions, or like I said, if there's anything I missed. So we finished 10 employment webinars across the
wait,
region.
Devika?
Yes.
Hey, the employment, that's.
Oh my gosh, I'm so confused.
Two contracts.
I'm so sorry.
That's the education committee on Wednesday.
Yeah, I
We're just
know.
looking at the videos.
I'm so sorry. I've got both of them like confused in my brain. I am so sorry, everyone.
We were talking about employment earlier too, so it's easy to get confused. I understand.
Yeah, I think that's where my brain was probably. I'm so sorry, everyone. Back to the videos. So we have finished all the fully included series. We got some, we received some feedback from the council staff, and their edits are being made. We have finished everything from what is the council to, and all the episodes are, of course, April done, the waivers about DSPs and in employment, and the families helping families resource center videos. And they are rolling out in production and distribution. And the last three, which are the direct support professionals, employment, as well as the waivers, are currently under second round of edits with our producers. So that way we're just making the last bit of edits, and they will be rolling out through fully included Fridays once they're all approved from the staff. They are captioned and all accessible features in terms of voiceovers, captions where needed. And they have been received really well on social media. Of course, April Dunn's video was one of the best ones in terms of distribution and reactions. And we are seeing that these resource videos are becoming very popular as we're rolling them out, because they're providing some good information or a kind of also like a face to a name kind of for the council. So we are really proud of the way they're rolling out and also discussing things that they're also touching points that are important to the families and people with disabilities across Louisiana. We also had one of IEPs, which was received very well, about tips from parents, any barriers, any resources that have helped with. So we're touching on these topics. And like I said, we are completely done with all the videos with just the last bit of edits left from my producers. And again, my apologies for confusing the two.
No, it's all good. Thank you, Devika. Are there any questions for Devika at this time? Brenton, do you see any?
I don't see any questions. I did just want to share, if I'm not mistaken, this initiative will continue into our fiscal year 22. Is that, I believe that's correct. So I guess we have more videos to look forward to as the year progresses. So I don't know if there's anyone on committee that might have some ideas of possible videos they might like to see. Certainly any input that the committee might have or any involvement that even some of you might want to participate in some of these videos would definitely be recommended and helpful. And I don't know if y'all gotten to the planning stage yet, Devika, so hopefully I'm not out of line, but I figured any input is better than none.
No, yes, we haven't gotten there yet. I know Amy told me about it, but we were waiting for the council meetings this week to be just kind of, I know you have are under a lot of pressure during these meetings. So thank you, Lillian. I really appreciate your comment. That's really nice. If you don't mind, can I just answer the question I see in chat? I'm sorry, I just kind of.
No, absolutely. Go ahead.
Okay. And there was another question that says, are these or will be on DDC website? They are on the YouTube page right now, but I think the website is also great to include. And I can work with Brenton on that idea and just add them in, but that's a good idea for sure.
All right. Thank you, Devika. Brenton, I'm not sure, is Adrian Thomas available yet?
We do have two questions that popped up.
Oh, I'm sorry.
Crystal and Lillian both have their hands raised.
All right, Crystal, the floor is yours.
Hey, Devika, quick question. I was wondering if it could be added to do about TEFRA, since that new program is now going to be part of the state plan and be a lot larger than what was anticipated. This is going to be, something that's going to impact a lot of the younger population for right now. So, and those young parents who are just getting into navigating this whole system. So I didn't know if we could add a video just to explain what TEFRA is and how to access it, the steps to take. It doesn't necessarily have to be a person. I don't know if y'all just do graphics and things like that, but that would also be helpful as well. Just anything for that program. Thank you.
Thank you. I just have a quick question. Could you explain what TEFRA is, or just the initials itself, so I make sure I write it down correctly? You're on mute, I think.
You're muted.
It's TEFRA.
Okay.
And TEFRA is for children under the age of 19 to access secondary Medicaid without looking at the income of the family. And somebody can correct me if I'm wrong from the department, but I believe that's just a very rough nutshell of what it is.
Okay, I can add that into our planning for sure. What you're talking about is what we call an explainer video, like when they're used to use graphics and things like that. That could be definitely a strategy if something is brand new and more of an explanatory video rather than more of a storytelling. So we can definitely look into that strategy. Thank you.
And that's something, Devika, we could probably connect you. I know you weren't on earlier, but we can connect you with Kelly Zimmerman, who's here currently with Medicaid, and Julie Hagan also, because they've kind of been providing the committee with a lot of the TEFRA updates. So I'm sure they'd be happy to help give you any information for that video as well.
Perfect. Thank you.
Lillian?
Thank you. So I have two potential video ideas. One, I think it'd be really neat if we had a video on how to get involved with the DD Council, because I think the DD Council can be a little mysterious at times for people who are not familiar with it. So maybe, how to apply to be on the DD Council or how to get involved with WCAN. And the second would be maybe a part 2 to the IEP video that's targeted towards self-advocates and youth on how to actively participate in your own IEP meetings as a part of the team, along with the teachers and parents as well.
Yeah, that's a great idea. And that's perfect because that was part of the video itself when they were talking about having students in their own meetings. So that's a great spin-off. I don't know what the cool video terms are, but we'll go with there.
Thank you. Yeah. And I think it'd be really, really powerful if we maybe had youth be in that video talking about their experiences being in the IEP meeting. Thank you.
Thank you. It's great ideas.
I believe Jill Hanno had her hand raised.
Again, another question from Brendan, if y'all will, but did the number is the activity number for the videos gonna change in FY22?
It might. I don't know off the top of my head if it does, but I can check and let you know in just a minute.
All right, thank you so much. And then I had another question, but I have, can I say something else, Kim?
Yes, Jill.
Add on what Lily said about the council and like how to get involved. We do really need to, like, we need self-advocate involvement, but then in general, and then I think we need to, like, in the same video, of course, but like we need to stress how we can get youth self-advocates involved, because this is coming up in other committee meetings, and like just self-advocates are important, but equally important in like maybe a sublet of that. Specifically, we need youth as much as we need self-advocates. It's important to stress that we need youth self-advocates. Thank you, Kim and Ms. Davika. Did I say that correctly?
It's Devika, but totally fine with that. Thank you.
I'm so sorry.
Oh, it's okay. I've been called worse.
And Jill, to answer your question, it will change to activity 1.1.5. And so that will be reflected in our agenda in January. And I also just wanted to share, I mean, there is listed in that particular activity, there are other topics that were listed as potential ideas for videos, like covering the ADA and the DD Act specifically. They talked about civil rights and IDEA and dispute resolutions, and LRS services, I think. So there's just a lot of other topics in that plan that has started as of October 1 that they have. And so just depending on how many videos they can make and put out there, you know, these might be additional topics that they can cover as well.
Absolutely.
Thank you, Brenton, for that. Okay, I see Adrian. I saw her. She was on. Oh, there she is. Adrian, you want to give us an update on policies and partners? Policy making and partners, please.
Sure. Did I take the mic off of mute?
Yep, you're good.
All right. Good morning, everyone. Just quick updates on partners in policy making. We have four areas that I'll focus on so that we can make this report quick and allow others for their opportunity. The first thing is that the class of 2020 session, we've been working on our class of 2020 sessions and activities. The class of 2020 will graduate on October 31st, 2021, not necessarily having a graduation ceremony. They'll have a little celebration virtually. But I do have a question or discussion for the council later. So hopefully so that we could have a in-person graduation when we are able to meet in person. As a part of their final project, the class of 2020 have been assisting with the virtual webinars that are scheduled for 2021. So they'll have 4 webinars. The class was divided into 4 focus groups. Those focus groups was inclusive education, family engagement, employment, and political action. And we chose those because those were the 4 areas that stood out the most with that class during the session. That also gives the audience an introduction or a snippet of what being in a partners class would be like. The webinars will be an hour long and will include a short interview or testimony from a partners alumni and an activity on the focus topic. Those are scheduled for Tuesday, October 26th, Wednesday, October 27th, Thursday, October 28th. Those will be held at 6:30 p.m. and will last only an hour. And then there is a Saturday. The final one will be on Saturday, October 30th, and that one will be at 9:30 a.m. The other thing that I've been focusing on, or that in partners we've been focusing on, is streamlining the application, some of the applications in job form, or putting applications or forms that are a part of the partners program in the job form. The first thing that was put in the job form was the actual application for partners in policy making. Just reviewing the information and coming in, there were 3 parts of that application, that actual application process. That was the initial application that an applicant would send in, and then the second part would be, the second and third part would be like the initial profile that also gather information, the statistical data that the nationals program also asked about, and then also the rule of conduct and the guidelines for participating in partner. So we were able to combine those applications, all of those parts for that application into one part, so that we could get that in all of that information initially, and once the applicant is accepted, we wouldn't have to go back and try to get that information and try to get that information, which we in my experience, that we were collecting as late as the first January session. The other form that was put in the job form was an alumni form. And the intent of the alumni form was to update and improve the alumni database, and to continue to extend information and opportunities for the alumni. And then the fourth and final quarter focus that I wanted to discuss and give you a little feedback on was the press and social media release for 2022 session. So the information for the job form links and the release to go to the social media pages and to send out to print the newspaper, the major newspapers in Louisiana and the news stations in Louisiana is ready and will be made available after a quick editor's review and a quick review from the DD Council staff. Any questions?
Are there any questions for Adrian? I see one hand. Crystal.
Hey, it's more probably for the general DD Council to think about. I know that a lot of us have all been through this class and we understand the importance of this class. And also we understand the importance of collaborating with other people and making those connections face to face. And I know that our past groups have, been affected where they haven't been able to meet in person and they are doing virtually. And I was just wondering if there's any plans to go forward to maybe getting these groups, these classes together for maybe, post-COVID when it's safe, a retreat or a continuing education, like in-person training?
I can answer that. Okay. That's in the plan. So one of the reasons that the alumni application was completed is to update the alumni so that when you receive the form, you are an alumni. I think I've seen your name, Crystal. Is that correct? So when you receive your alumni form, there are going to be there's a question in the alumni form that will ask you in 6 different areas, how do you want to, how do you check all that apply of how you want to continue your partners in policy making efforts. So just for example, one of those things might be mentoring a person that's currently in session, being involved in the regional groups, because at one point, and I do notice, I heard, Crystal, that you were out of the loop for a while. So I don't know if you realize I'm new. So as we're crossing paths, one of the new things is I think in the past, there were regional groups. And so one of the things with that alumni forum is to reestablish those regional groups so that refresher activities can be established. I can tell you some things that I put in ideals or possible activities and things that I would like to move forward with, but of course they have to go through the process of being approved and so that we can move forward. And one of those things is to have a roundup with the alumni, the opportunity to have a roundup and to have refresher classes. And especially, the class of 2020 is my baby because that's the class I started with, and it's taken us 2 years to graduate. So of course, we would love to have updated refresher courses, not just for them, but for everyone.
I just want to say thank you for your commitment to everything, and you're doing a great job. Thank you so much.
Thank you.
Jill Hanno.
What is a Trello board? Please, will someone explain that to me?
Once again, the Trello board is one of the applications that partners in policy making use for our virtual classes because in Louisiana we are traditionally in-person classes, and of course with COVID-19 we wanted to conclude and finish and complete the class of 2020. So the Trello board is just an application or a way that the class was able to meet. So when presentations were provided for the class to view, and you would have we had a speaker that had a PowerPoint with verbal, with visual and verbal presentation. And if I was to send that to someone who has a Yahoo account, the video presentation would be too large for them to even open. Their account probably would possibly reject it. So with the Trello board, I'm able to load up that video on the Trello board, and regardless of what type of email account or what type of cellular phone you have, if you were using your phone to access your information, or what computer you have, you could still view the information in that way. And it also allowed the class participants to communicate back and forth. So basically, to answer your question in a simplified way with all of that explanation, Jill, it was remember the handbook you received when you were in partners in policy making? It was an opportunity for me to create a working handbook. So those things that that paper that you would have received, I was able to put it on that board and not just mail it out to you or send it to you by email. And if you're on the board, you could always go back to it. I hope that answered your question.
Thank you, Adrian. Are there any more questions? No? Okay, great. We're going to move on to Ebony, who'll give us an update on her initiatives.
Hi, good morning, everybody. I'll be giving you updates about LACAN, FHF, and supported decision making. So I'll go ahead and start with LACAN. And if you're following along on your status report, you can find information about LACAN on page 3. So we're holding steady. As of September 2021, LACAN still has about over 6,300 members registered for LACAN and the council's listserv. As far as advocacy activities, that information from July to now still remains the same, just because session ended in June. So there haven't been any more legislative visits to report and no new action alerts. All of that information is the same. But if you have questions, I have the information here about action alerts and legislative visits. Just an update on LACAN leader positions. I am very, very, very pleased to announce that we have no vacancies for LACAN leaders. Woohoo! We have a LACAN leader in every region of our state. Every region of the state right now. And I just wanted to take this opportunity to acknowledge all of the LACAN leaders and all of their hard work, their dedication to LACAN. Especially with all the challenges that we've had to face last year and this year. They advocated virtually this year very successfully during the 2021 legislative session, and they were very successful in keeping their members engaged and involved virtually, despite the pandemic and despite LACAN not being able to be at the Capitol this past session, just because the council still had the in-person activity suspension in place. So I did want to kind of just acknowledge them and just let them know that all of their hard work and dedication to LACAN is appreciated. And I did want to welcome again and announce our 2 newest leaders. We have Miss Christina Martin in Regions 1 and 10, and our newest leader is Miss Katie Crows in Region 2, who have both hit the ground running. So they were very excited about advocacy, very excited about getting started with LACAN. And so they have already sent out October newsletters. So be on the lookout for those. And for those of you all who are in Region 2, our LACAN leader, Miss Katie Crows, she's doing her meet and greet on October 28th. So I did just want to kind of just give the LACAN leaders a shout out because they've been doing great work. LACAN continues to host 2 calls a month. And during those calls, we just talk about current issues or concerns, anything that comes up. And we try to help them develop strategies on how to continue to educate, maintain, and support their LACAN members. So a lot of things happened over the summer. There was the summer LACAN leader training that was held on August 25th. And at that training, the leaders discussed ideas and strategies for improving advocacy activities, such as legislative visits, action alerts, roundtables, yellow shirt days. Since we are doing those things virtually right now, we just tried to come up with a more efficient way to do those things and just ways how to keep their members involved and engaged. The leaders also discussed like how-tos, how to do things on social media, how to keep their members engaged via social media, how to broadcast legislative committee sessions on social media. So they got a lesson on how to do that and how just to do things on social media more effectively so that they can keep their members involved and engaged in our new virtual world. Also during the summer months, mainly August and September, the LACAN leaders hosted their regional community input membership meetings in each region. And at those meetings, the leaders discussed the outcomes of the 2021 legislative session, the legislative process, and they asked their members to provide input for the council's 2022 legislative advocacy agenda. At those meetings, the leaders collected over 90 issues and concerns from their members. And those items will be shared during the executive committee on this Wednesday at 3 p.m. So there should be a full list that's shared with that committee. Also, there was legislative kickoff, which was held on September 23rd. And that is where the LACAN leaders and the FHF directors, they get together, they discuss those issues that were collected at the LACAN membership community input meetings, and they prioritize them and they rate them. So once they rate them, they vote and they generate the top items that they're going to send to the full council for recommendation towards the council's 2022 legislative advocacy agenda. And again, those recommendations will be shared during the executive committee meeting on this Wednesday, October 20th at 3 p.m. So just my final update for LACAN fall training will be held next month in November. And that training basically focuses on preparing the LACAN leaders to conduct their legislative visits with their legislators in their regions once the council sets their 2022 advocacy agenda. And that should be done by Thursday. So we also discussed what they should look for as far as testimonies for their roundtables, testimonies for their legislative visits, and testimonies for the committee meetings during legislative session. So November actually marks the beginning of our legislative visits. So information about legislative visit teams will be sent to the full council after the meeting on Thursday. And that list will include the parent and self-advocate council members in each region, the LACAN leader, and the FHF director, with everyone's contact information included in that list. So it also lists the regional delegation and those members that are on key committees. So please follow up with your LACAN leaders about making those legislative visits, and they'll be following up with you as well. So the goal is, and we tell our leaders this, that we want to make sure that we see legislators that are on key committees first, and then everyone will follow after that. So be on the lookout as well for LACAN membership meetings. Typically, once the council sets their agenda, which will be on Thursday, LACAN leaders start hosting meetings just to educate the members on what the council will be advocating for the new legislative session. And just remember to get involved, and that roundtables are going to start January to February next year. I know that's coming up really soon. We're already in November, so we want to just kind of be in the mindset that roundtables are going to start really soon. Does anybody have any questions about LACAN?
I believe Jill Eagley had her hand up.
What is with the Lacan and Didi Council for next fiscal year 2022? What's the main with the legislative session, the funding source are going to be? When they have to do their advocacy agenda, Didi Council, what are we aiming for?
So Jill, you guys are going to be deciding that on Thursday. So at the executive committee on Wednesday, you will receive the top recommendations from the Lacan leaders and the FHF directors, but it is still up to the council to decide what you all will advocate for the new legislative session in 2022. So we hope to have those items on Thursday by the end of your meeting.
Yeah, because I always say, provider DSP rates, because I go to the ARCA GNO Uptown Community Center. I know that funding needs to be level out for rates so we're not in a crisis mode in Louisiana.
Right.
Thank y'all.
You're welcome.
Thank you. Jill Hanno, your hand is raised.
Okay. I don't think I got, cause did y'all do the member meetings for the legislative sessions already?
Yeah, so Jill, they would have had
I don't
meetings.
think I got like a notice.
Okay, they would. I think Christina might have had her meetings maybe late August, early September. And if you didn't get a notice, I'll just make sure that she has your email address and your contact information so that you're getting the information.
Because I know that Nicole used to have to call me every time. And she's like, there's a meeting, because I never knew. Like, I check my email multiple times a day, but I never know when the meetings are. So Nicole used to call me and say, okay, there's a meeting today. But my next question is, I know that on our agenda for the executive committee Wednesday, one of our agenda items is, of course, the legislative agenda for 22, but I was specifically looking for, we do, or you do have the like the results from the input from FHF directors, and like, do we have, oh no, I'm sorry, does the executive committee have hard copies of those reports from the member meetings in the FHF directors in the how many issues did you say it was?
It was like 93 issues, but that included duplicates. So the list that you have will not include the duplicates. And I see that Amy has turned on her camera. So I know she's going to be sharing that information with the executive committee. Amy, if you want to add.
Yeah. Hey, Jill. It's linked to the agenda that is on the website, and I'm about to mail it out to the executive committee as well.
Okay.
And those documents are linked. They were linked late, so that's how it ended up on that agenda, not in your packet.
Okay. Thank you.
Sure.
I hope I don't bug your staff with my let's just be real. Like the hard copy girl, which I need to think of another word for that. But like by now we all know how Jill is about the paperwork. And I sincerely hope I don't get on y'all's nerves.
You're fine, Jill. We're here to help you. We're here to support you in any way you need. So don't ever worry about asking questions or needing paperwork.
There it is. Thank you, Miss Amy. Whoop, there it is.
Okay, Ebony, I'm going to move on. Is it time for supported decision making?
Wait, Crystal, did you have a question?
Oh, I'm sorry, Crystal. I missed your hand up.
That's okay. Quick comment. I just wanted to remind Jill and everyone as council members, if there is a topic that was important to us, we can always bring that topic to that agenda item to the full council meeting and get that added to the agenda. So if there's a topic that's near and dear to you, you can add a motion at the full council meeting to add your agenda item and we can vote there for it.
Hey, if I may add to that also, you can go to the executive committee meeting as well, and they accept public comment. And if you have something you'd like them to consider there as well, they can add it on their recommendations too. So that's 2 opportunities as well to try to add additional things onto the agenda that may not have been captured at some of those community input meetings.
I can move on to FHF, Kim, if you'd like me to. Okay.
Yeah.
So if you're looking at your status report, you can find more information on FHF on page 6. But on the agenda that we have for today, the year-end data was included for FY21. And this is our annual summary that Brenton is sharing right now. I'm not going to go over the full report, but I did want to highlight that due to various reasons, including the COVID-19 pandemic, 6 centers were unable to meet their deliverables. And you can look in the chart that Brenton is showing right now. If you see the grayed areas, that will show you the deliverables that those centers were unable to meet. And then there's information below that as to which deliverables they did not meet. And I did speak to the directors of those FHF centers, and they did provide information on why those deliverables weren't met. But as part of our monitoring process, they are supposed to submit a corrective action plan when they don't meet the deliverables, just to state how they're going to meet those deliverables for the next fiscal year. So I will be getting with those directors just to get more information about how they plan to meet those deliverables for fiscal year 2022. Does anyone have any?
deliverables?
Here's the definition of deliverable. A thing able to be provided, especially as a product.
Does anyone have any questions about the summary for FHF? I know some of the directors may be here if you guys have questions about any of the deliverables that were not met.
Brenton, are there any questions that you see?
I don't see any hands raised at the moment.
Excellent. Let's move on to supported decision-making.
Oh, I was just going to share one more thing, Kim, the first quarter data for the FHF centers for this fiscal year. So with the FHF centers, their fiscal year starts in July because they are on the state fiscal year. So I already have first quarter performance data for the centers. And Brenton sent an updated copy of this chart last night to the committee members, and it should be linked to the agenda for today. The one that was sent previously, we didn't have information on Bayou Land, and I think NOLA was missing information, but I was able to get that information for today. So everything is updated, and this is where they are currently for first quarter performance. I do want to point out that there have been deliverables added. The Section 504 of a Rehabilitation Act of 1973 training was added. There are 2 trainings that were added for that. And I think that's, well, there were deliverables. I mean, not deliverables. There were different outreach settings that were added for the centers. Initially, it was hospitals, pediatricians' offices, and school districts, but we also added ABA clinics and physical therapy clinics that they can reach out to for their outreach visits. Does anybody, oh, Lillian, you have a question?
Morning, Miss Ebony. It's good to see you. I was just wondering, what is generally included in the Section 504 of the Rehab Act training?
So I know that Dr. Charlie Michelle, he is helping the centers develop that training. What he is putting in specifically, I can get more specifics about and share that at the next committee meeting, or he may actually be on the call today. I'm not sure. But I know he is helping the FHF centers to develop that training. But I can definitely get more specifics for you and either email that to you or email the whole committee and let them know.
That would be great, because I think whenever we talk about Section 504, it's no matter what we talk about with Section 504, it's always really important to include the history behind it, including the sit-ins that happened, the people with disabilities that sat in the health, education, welfare buildings across the country, because that's a really cool part of our history. And I think it's really important to talk about when discussing the impacts that it's having on our community today.
I don't see any other questions.
You see in the chat, Susan Green, who is our FHF director in the Southwest Louisiana area. She had mentioned that the Section 504 training will be specifically directed towards education issues.
Okay, so if there are no more questions, I can move to the supported decision-making. The council contracted with the ARC of Louisiana on this initiative, and these training opportunities were offered statewide to both adults with intellectual and developmental disabilities and their families to help increase their understanding of the supported decision-making, also known as the Dustin-Gary Act, and other legal options available in Louisiana. Due to COVID restrictions and the council's suspension of in-person activities, all of the trainings were held via Zoom virtually. So in the agenda, there's the year-end data for FY21, and it's included. Brenton is going to share it right now. Just to highlight a couple of things. Since the contract started October 1st, 2020, the ARC was able to complete 10 trainings, and they were able to train 134 participants. And there's the breakdown of the participants at the top. If you wanted to know the breakdown. Also, just to highlight this, the training that was scheduled for Regions 1 and 10, it was scheduled for September 1st, but had to be canceled due to Hurricane Ida. Fortunately, the council is continuing this initiative for FY22. So the ARC will be adding the training for Regions 1 and 10 to their to the next contract year for FY 2022. The ARC was also able to identify 4 participants to mentor, and they have agreed to continue to mentor those participants through the supported decision-making process until those individuals have identified supporters and an agreement has been executed. The ARC was unable to find a 5th participant to mentor through the process, which they were contracted to mentor 5 individuals. But again, like the trainings for Regions 1 and 10, they were unable to complete. This individual will be added to the new contract for FY 2022. And we'll continue to give you guys updates. As you can see where each participant is in the process for the mentoring. And we'll continue to give you all updates at each meeting for FY 2022. Does anybody have any questions?
I don't see any hands raised.
Okay, well, that's it for me, Kim, unless you have
Thank
any
you, Ebony. Appreciate it.
Mhm.
Brenton, do you want to update us on your activities, initiatives?
Sure can. So y'all been seeing me in the shadows. I get to actually get on camera now. How exciting is that? And before I start, just a shout out to the committee. So everybody but one person on this committee made it to the meeting today, which is fantastic. So just props to all of you guys for showing up. Okay, so getting started, the first thing we're going to talk about is our activity 1.4.4. And as Ebony mentioned, if you are looking online at the status to plan activities page, it starts on page 9 for this particular activity. And so this initiative is one that we contracted with Trach Mamas of Louisiana to develop a website that can be kind of like a one-stop shop or a sort of resources that people could access during times of emergency, whether it's natural, man-made disasters, or even personal emergencies, or in this case, the new normal, which is a pandemic. So in September, we sent out an LADDC news that announced the initial launch of ladisabilityresources.com. And so that LADDC news, I believe, was linked in the agenda online if you need to access the link for that webpage. And so while the council did provide funding to help create the website, the maintenance and updates is going to be done by Trach Mamas of Louisiana. So anybody that's using that website, if you do have any content suggestions, any updates that you think need to be made, any edits, suggestions, concerns, you can always reach out to them at trachmamas@gmail.com. But if you go to the ladisabilityresources.com website, or if you go to the LADDC news that we linked in the agenda, it also has their contact information there. Just if you want to provide suggestions or if you have comments or concerns. Whenever they launched the website, they also sent out a survey, and basically they wanted to get feedback from initial users just to get an idea of their experience with the website. So I just wanted to share a little bit of data from that survey. So in total, they received 35 responses to the survey, and 30 of those individuals indicated that they would either very much likely or would likely recommend this website to other people for their use. And also of those 30 individuals, they said that they would keep coming back to that website for additional resource content when needed. 2 of the individuals actually stated that they would not recommend the website to anyone, but they didn't provide any feedback or suggestions for their concerns or what they would improve on the website. For those of you that did take the survey, you know that there was like a little comment box at the end of the survey that allowed you to share anything that you wanted to, but these individuals did not share any suggestions for helping improve that website. Of everyone that responded, so out of the 35 responses, 4 indicated that they were a person with a developmental disability. 24 were either parents or caregivers of someone with a disability. Another 4 indicated that another 2 indicated that they were paid caregivers. So that would be your direct support workers. We had 3 take the survey that were just professionals that worked with the DD population, and 2 others did not identify themselves. As far as feedback for that website, we really didn't get a whole lot of feedback. There were actually only 3 comments. One mentioned including information about the districts and authorities on the website. The other one was simply just a good job, keep up the good work sort of comment. And then there was another comment that said the website should be advertised to more individuals, not just the DD community, which we did do. I mean, our listserv obviously includes lots of individuals and families that are impacted by developmental disabilities, but it does serve as a listserv for just disabilities in general. We did share it with stakeholders for them to share with their groups as well. And I know Trach Mamas has done the same to try to get the information out. So we do encourage all of you to share about that website as you're going through it with anybody that you think it might benefit. And also just keep the lines of communication open with Trach Mamas if you have an idea of information you would like to see on that website as well. It looks like Lillian, you have a question about the website?
Hey, Mr. Brenton. So the one thing that I would say is that whenever you guys were taking feedback from the surveys, I noticed that there was a very small amount of people with disabilities who gave feedback. And my only concern is that whenever we have a really small group of people with disabilities that give feedback, we may not necessarily have a diverse group of people with disabilities. So maybe, okay, one individual who's blind says, okay, this is accessible, but they're using a specific screen reader, but someone who uses a different type of screen reader, that website may not be accessible to them. So I would definitely recommend getting more feedback from a larger group of people with disabilities so we ensure it is accessible to a diverse group of people with disabilities.
Sure, yeah, we can send that suggestion to Trach Mamas for them to keep doing surveys about their website. Yeah, that's great. This isn't something that continues into our next plan, and so fiscal year 22. But I can certainly provide those suggestions to them to continue that on their end. And it looks like Melinda Elliott has a question.
Oh, I'm sorry. I did that by mistake. I'm so sorry.
Oh, no problem. Let's see. Okay, so any more questions about the website? Otherwise, we'll move on to the next issue or initiative, I should say. So next up is our first responder pilot. And that is activity 2.7.3, and it's on page 15 of that status report. And so this is, we've contracted with a group, they're called Interaction Advisory Group. I think they're out of Alabama, for this particular activity. And so the intent of this activity is to train first responders. So that's inclusive of law enforcement officers, fire and rescue, your emergency medical technicians or EMTs, your paramedics, and similar professions, to really establish and implement policies and protocols on their end within their departments on how to appropriately address individuals with developmental disabilities, and specifically from a law enforcement standpoint to really try to see a reduction in arrest and other physical escalations that may occur. And so they've been conducting these skill building training activities with these first responders, and to really raise awareness and just an understanding of appropriate interaction and treatment whenever they do encounter individuals with developmental disabilities or disabilities in general. And the trainer for this course, he's got a really unique perspective in that he's former law enforcement, and he's also the parent of a child with a disability. So he's able to really present to these departments from a dual perspective. And he also incorporates individuals with disabilities into the training. He likes to at least have one or two individuals there with him to be able to share their firsthand experiences and kind of give advice how they may interpret a situation. So those that are participating in the training can really get some interaction there from someone with a disability and not just another professional. We did share an LADDC news about this initiative on the 29th. And so since 29th of July, sorry. And so since July 1 or this past quarter, we've had 8 training sessions that have been conducted under this initiative for first responders. And 6 of those were done in kind, which means they did not charge the council for those particular trainings. They've actually every quarter they tend to almost quadruple the number of trainings that they offer just in kind, it seems, because they're very passionate about the work and they're really hoping to get a lot more law enforcement offices or other first responder offices involved in their training. So this past quarter, there were 219 first responders that were trained. And so they're at about 680, I believe, or 690 individuals that they've trained so far throughout this year. And this is an initiative that's going to continue into our federal or our fiscal year 22, which starts October 1. So these monthly trainings are going to continue. They're also going to be incorporating additional trainings for the general public. I think there's going to be about 6 of those throughout the year that's going to provide information about local resources and events, but also focus a lot on different techniques that the general public may be able to use whenever they have to interact with first responders or law enforcement agencies. So any questions about this particular initiative? That's really the only update now. We will advertise the first responder trainings and the trainings that will be open to the general public once we get an idea of what they've scheduled those out for this year. I don't have that training schedule yet for the new year. All right. I see Julie has joined us. I'm gonna try to finish up my other 2 really quick. So if y'all have more questions, we can put her back on the spot. Thanks for coming back, Julie. Okay, emergency preparedness and response training. So this is activity 2.7.4. And that is also on page 16 of your status report. And that's being done by Niagara University. We've contracted with them to establish a training program on emergency preparedness and response here in Louisiana. And so they target individuals that have the responsibility in emergency planning and preparedness and response and recovery as it pertains to individuals with disabilities and their families. They refer to it also as access and functional needs. And so we shared an LADDC news about this on July 26th, talking about this initiative and upcoming trainings. And unfortunately, this past quarter, due to Hurricane Ida, 2 of their trainings had to be canceled. They were able to do one of the trainings on August 10th, and it had 42 attendees. But due to the extensive impacts that we were going through with Hurricane Ida, those webinars that they had scheduled for the August 31st, September 21st, and September 23rd, those had to be canceled. Some of them were directly impacted at the time frame that Hurricane Ida was on us, and then others, it's just with the cleanup and the response. There were a lot of individuals that they like to target for these trainings that they felt would not be able to participate due to the ongoing response for Hurricane Ida. So they are going to complete those makeup trainings in this upcoming fiscal year. They kind of had a two-part process going. In FY21, they were doing these webinars to kind of introduce people to some of the needs that they've uncovered in the state and just general ideas for implementing good, solid emergency planning and response for people with disabilities. And so in year two, which I think it's going to be not at the beginning of fiscal year 22, it's probably going to be more towards the spring or even closer to summertime, that they're actually going to come to Louisiana in person and offer in-person trainings. And that's going to, for different agencies that want to participate. And the idea is they'll get the training manual and the information that they've done in other states. I think they're doing something similar in Nebraska. They've done it in New York. And so they're going to come back with that training manual. And hopefully that those that participate in this training can go back to their departments and start implementing this emergency management and disability awareness protocol. So as soon as we get dates of when those sessions will be scheduled, we're going to push that information out as well. Any questions about that one? I don't think I see any hands raised. Okay, and so moving on, we have our rapid response initiative, and that's also with Trach Mamas of Louisiana. It's activity 2.7.5, and it's on page 17. And so the purpose of this initiative was to be able to assist with funding to make sure that in times of natural man-made disasters, that families would have access to things that they need, like medical equipment or supplies, stuff that they may have lost during this disaster, or stuff that they may not have because maybe Medicaid doesn't cover it, or their private insurance doesn't cover it, or there's only portions of whatever they need that may be covered. And so what the council has done is provided this funding to Trach Mamas of Louisiana for them to be able to purchase these supplies and this equipment that people might need during emergencies or natural disasters, also during any hardships. The key is just though to show that we're not duplicating any efforts or any other funding that's out there, which is why we have to show that it's something that is not covered via their insurance, or that there is a financial component that makes it very restrictive for them to be able to purchase whatever it is that they need to ensure the safety and well-being of themselves or their family members. Trach Mamas has been working, especially since Hurricane Ida, with other groups to make people aware that they are there to offer assistance when needed. We did send out in the LADDC news in September, where we advertised the creation or the launch of that LADisabilityResources.com. We also shared about this initiative and that there was funding that is available to assist if need be. To date, there's only been 4 families that have requested assistance. And for the most part, all of those families, I believe, were really trying to replace a lot of incontinence supplies that were not covered by their insurance that they lost during Hurricane Ida. But it doesn't necessarily have to be tied to Hurricane Ida. You know, I know Southwest Louisiana is still recovering from hurricanes last year. I know the capital area is still impacted, or at least some areas are still impacted by flooding that happened over in the spring. And we also are still in a public health emergency. So I just wanted to make everybody aware of this initiative. It is going to be extended through June of 2022. So any remaining funds from our fiscal year 21 that was unspent has been rolled over into their fiscal year 22 contract to continue until June. And so basically, if you know someone that needs help getting through some of these disasters that we've been faced with, they can reach out to Trach Mamas directly. Their number is 225-200-5178. You can also get them via email at trachmamas@gmail.com, or trachmamas.org is their website. And I can put that information in the chat. Let me do that. So I know I kind of said that pretty quickly. Everyone, there we go. Also linked in the agenda is is the LADDC news that we had sent out, and it includes information about trach mamas there as well. So the same contact information you would use to share any feedback about the website is the same information you would use if you're reaching out to them for any assistance. I think I do see a couple hands raised. Jill Hayno, you have your hand up?
Thank you, Brendan. Okay, so like I'm embarrassed to say that I've been working on this since July, but I swear when Mr. David came in July, he broke down everything, what trainings he did. Or I know we had a funding request from Mr. David in July. Then he gave us an explanation as to why he needed more funding, and he broke down like specifically what trainings he did. I have a couple questions, if that's okay, Kim. He broke down what he did in 21 versus what he plans to do in 22, and kind of the justification. And I watched our meeting twice online, and I looked through all my notes in the transcript and couldn't find anything. Like, do y'all know what I'm talking about? That like he specifically gave numbers of what he did versus what he plans to do in his justification of the funding increase. Like, if I was that information, where would I be?
Well, I don't think there was any specific information that he provided in a report form. So I'll put it in the chat now. That is the SOP that he came and talked about, which essentially in fiscal year 22, he put in a request just to continue this initiative, which is kind of what we talked about. It's his in-person training where he actually comes to Louisiana to actually train on the specific program that he's trying to implement in various states, wherever he has his contract with, similar to what he implemented in New York. So in the link for the SOP that was discussed at the July meeting, it details what he would, or what Niagara was requesting to do with the funding. And he didn't provide any other reports during the meeting.
Okay.
So I think it was just him verbally.
Now I'm gonna look at the email you sent me, and yeah, I'm gonna read the 22. I have everything set up to compare the SOPs from 21 and 22. So that's what I'll end up doing. And then can I ask another question, Kim?
Yes.
I don't know if I can. Hold on. Oh, do you know, or does anybody, I think I've talked to staff, but is there anything online for public viewing that kind of mirrors or overviews or outlines the booklet, what they talk about in the big training manual?
With regard to that contract?
Now, with regard to what they talk about in training.
Not that I'm aware of. The webinars that he's conducted, to my knowledge, are not online. He offers them throughout the year, a morning session, an afternoon session. But to my knowledge, they're not recorded and kept online.
Are they free?
To attend, they're free, yes.
Okay.
Yeah. And in fact, if I'm not mistaken, the morning session is probably more geared towards families and individuals with disabilities. The afternoon session is probably geared more towards professionals, but he really wants and encourages people to attend both sessions. And so what he's been doing with the webinar, it's kind of a precursor. He just talks about the needs that are out there as far as emergency planning. And then in the second year is when they actually bring the program to Louisiana, and those that would attend the session will be trained on that program with the responsibility of implementing that program within their departments or their parish or their region, whatever they're responsible for.
So, unless I missed it, is there any weapon opportunity for me to sign up for an upcoming webinar?
There will be, but I don't have the dates yet. So the 3 that I had mentioned that he had to reschedule because of Hurricane Ida, he's going to reschedule those into this fiscal year that started October 1. So you'll be able to attend those. Those are going to happen again.
So but specifically, there are opportunities for me to attend virtual sessions, correct?
Yeah. His initial webinars were held virtually.
Okay, thank you.
You're welcome. And I think Crystal has her hand raised.
Hey, Brenton. Yeah, I wanted to make sure I was understanding the emergency funds for crisis situations, correct? The emergency and crisis situations. I was hearing you say, first of all, I know that that's a huge need, right? Secondly, I heard you say that we didn't spend all of our money. So in my head, I started thinking about whenever you said it had to show that we weren't duplicating dollars and there had to be a denial from insurance companies and things like that. I know for my insurance company, it takes me months to get that denial letter back to prove that it was denied and that this is actually still a need. But if I'm in a crisis situation and I'm waiting months to get back a denial letter to get you to approve it, I'm just wondering, since we know that the things that have already gone through the process and were approved, like incontinence supplies is something that you gave an example of. Can we have can we try to streamline it more to get these people the help that they need during the actual, right after these emergencies, not months after? Because I can tell you it's exhausting going through all of the denial processes, that it might just, you throw your hands up and you just say, you know what, nobody's going to help me, and it might not seem worth going through all of this to get the help. So I just wanted to throw that out there. Maybe we can think about, possibly adjusting and shifting this program to be helpful for the times that they're supposed to be helpful. Thank you.
Right. And I understand that. And so a lot of the I guess, the program specifics, we have put on, oh wait, sorry, I see a comment. I was wondering, is real buried utilizing the funds? Yeah. So Bambi was just saying that what Crystal is describing is a real barrier to utilizing the funds the DDC has Trach Mamas distribute. So when the contract was originally written initially, and this was, I guess, the spring of 2020 that this was talked about, when this was added as a possible initiative. And then I think later in the summer, there was a discussion with the SOP that was submitted. There was some concerns there about potentially providing federal funds for something that would be covered via insurance, or whenever we don't have any we don't have anything documenting that this could be a financial concern for families or a financial hardship. So there was some concern with contracting just to write a check out to via a contract just to pay for things that are hard to come by. So we did kind of leave it up to Trach Mamas exactly how they want to implement this program. We did tell them that they are able to provide reimbursement to families. So let's say, you know, this is something that your insurance is not going to cover, and you went ahead and you purchased it yourself. If you keep those receipts, they can provide you with some sort of reimbursement, and then they can seek reimbursement from us as long as we have that itemized receipt that shows exactly what it is that's purchased. And a lot of times, at least in the form of incontinence supplies, we haven't asked Trach Mamas to send us a notation from the insurance company saying you're denied for this. Just the family tells us that that is something that's not covered. And so if the family is willing to say that they know that that's something that's not covered in their insurance, we've approved the reimbursement of those funds. So I don't want folks to think that they're going to have to wait through a long denial process, because I mean, an urgency of need there is also something that can be considered as well. But ultimately, we leave those decisions up to Trach Mamas. Sometimes they do get back with us to see if that's something that they would be okay with purchasing. But in general, we just kind of leave it up to them on how they want to utilize those funds and make sure that the needs are covered for what they can. It's also not a very large pot of money. The council, I think, was maybe $10,000. And then once you add the administrative cost of 8%, I mean, you're looking at probably closer to $9,000 that they had to spend. And we know that's not going to go very far. But it was just kind of something to get the ball rolling, at least in that particular initiative. I guess some of the thought was that maybe other organizations would follow suit to try to do something similar, and maybe there would be a larger rapid response network that would result from this, but I don't know if that's something that's being considered by other organizations or not. I think, let's see. Oh, Bambi has her hand raised. Bambi, I think I unmuted you.
Hey, can you hear me?
Hey, yeah.
Okay, so I just wanted to echo what Crystal was saying, and I think that I don't know what's going on my computer. I think that my experience with working through these disasters and with Trach Mamas, that there seems to be some issues. I mean, the example that you gave of people can pay and keep their receipts. I mean, people don't have money. I mean, we talk about equity. Like, I feel like, you know, the thought was good with that money, but like in a disaster, it really needs to be more flexible. And if, you know, the DD Council's funding can be more flexible, then maybe it needs to be through something else. But, you know, it's kind of like waiting on, you know, going through your insurance to see if your insurance is going to pay, then maybe FEMA will pay, and then you're waiting forever. Like, people get caught in these cycles, and then we have equity issues. So the people who can put the money out, they may be able to make it, and the people who can't, then they don't get what they need. And so I feel like there's some barriers to this funding that the council didn't intend, but they exist. So just wanted to share.
Yeah, and I would completely agree with that. it is a tough contract, to be honest, as far as some of the restrictions that we do have to be able to utilize that money. But also one of the things, you know, for instance, it could be generator. It doesn't necessarily have to be a specific medical supplies, but obviously if you're out of power and you need to utilize various machines or equipment, you can go out and get a generator. You don't necessarily have to do it yourself. You can reach out to Trach Mamas. They can go buy it and get it to you directly. But then also when you look at their operation, I don't know how quickly they can get it to you. But it's certainly not perfect. I think the intent was good. We did have some discussions about trying to continue this initiative because of some of these barriers, and they opted to continue it. But as we move along, we try to figure out ways that we can make it work, and we're trying to do that. But it is, it's certainly not in my opinion, it's certainly not the best way to utilize that funding, because it really is kind of hard and doesn't necessarily meet the needs as timely as most folks would want. But we're also not getting a lot of requests either. And so it'd be really nice if folks would reach out to Trach Mamas to even see if they qualify. Again, it could be something that has already happened. If they have the receipts, they could be reimbursed. It could still be a need currently. Again, if you're impacted by a hurricane, a disaster, which we all are, and it could be something old, it doesn't have to be something that just happened. It could be tied to COVID. We even had a discussion about approving things as simple as just buying people thermometers if they needed that. I mean, it could be something simple, it could be something larger. I think the creativity just has to be there to be able to utilize that funding pending requests. I think just the big part is we haven't been getting a lot of requests, or at least what's been told to me, we haven't been getting a lot of requests. I think Jill Hano has her hand, and then I think we'll go over, there's an attendee that has a hand raised as well.
So, okay, I know that we got, so other than you, are all our contracts for 22 or all the proposals identical to the proposals we got last year?
I guess it would depend on the initiative.
Okay.
So for instance, we talked about IAG, or Interaction Advisory Group, doing the first responder trainings. The planning committee in the spring said that they wanted to continue that initiative as it was. So their proposal would be the same. Niagara gave you a different proposal because they have a multi-year kind of step in the program that they do. One is an introduction, one is an implementation. And so it really would depend on the initiative. But I think we did have that discussion as well with the planning committee that in the spring, where they were just checking off the boxes and continuing everything. So for the most part, I think a lot of initiatives just continued into this year. So they would be very similar, with the exception of Niagara, but I can't rattle off the top of my head if all of them have changed. But yeah, it's probably similar if it's just a continuation of the same.
Thank you.
Let's see. And Melinda, you have your hand raised as well.
Does the DDC happen to know if there are requests to Trach Mamas that have been refused?
To my knowledge, none were refused. But to my knowledge, only four have been made from 4 different families. But I haven't heard of any that were being refused. But it could also be, I mean, they have other funding. They also have other resources that, if I'm not mistaken, they have a warehouse full of different equipment and things that they may already be able to provide. And so they may have been able to assist people outside of this contract. But to my knowledge, nothing has been refused yet.
Okay, thank you.
Mm-hmm. All right, seeing no other questions, I will move on to the last thing I have here, which is our abuse and exploitation trainings, or training on healthy versus unhealthy relationships. That can be found on page 20 of your status of planned activities. That's activity 2.9.1. And this initiative will be wrapped up with our fiscal year 21. It's not continuing into fiscal year 22. And so this is a contract we've had with Team Dynamics since fiscal year 2019, I believe, so the last few years. And this initiative really focused on just making sure individuals with disabilities and their caregivers get information about healthy and unhealthy relationships, sexuality, and hoping that by understanding those healthy and unhealthy relationships, that they would be able to identify when they are in an abusive relationship or in a relationship that is exploiting them. So in the agenda is linked a handout that provides you with information over this past year for the program. So during the contract year, so that would be October of last year until September 30th, there were 9 training events that occurred. These were webinars. Due to COVID, they were doing these via webinars as opposed to in person. There were a total of 144 individuals participating. So we had 17 self-advocates and 127 family members and caregivers that participated. They also hosted, they call it a 6-topic Healthy Relationships Matter retreat style training. So the contractor did a pilot program that was in the North Shore area. So that was not something that we had contracted with them to do. And they basically, what this retreat does is just go into a lot more details, because it's a 3-day event, and it's usually a full day that they meet. So they can go into the self-advocate portion of training in a lot more depth and detail than they can in just a 2 to 3 hour webinar. And so they had one scheduled in the Houma Thibodeau area when they thought they might be able to do it in person. And so that was originally scheduled to be done in August. So August 24th, they had 9 participants there, but they ended up having to do it virtually. They could not do it in person because of the Delta variant increasing. So they moved it to a Zoom format rather than an in-person retreat. And unfortunately, due to Hurricane Ida, they could not continue with the other 2 sessions that they had. So they had to reschedule those for September 29th and October 5th. And those did happen. And I think participation was a lot lower at those. There were only 2 people that were participating in that one, or 2 return self-advocates that have participated in that one. But those that couldn't attend, they were also able to attend. There was going to be another another retreat training that was going to happen in the greater New Orleans area that was going to be done on October 1st, 8th, and 15th. I don't have information about that particular session yet because that was done, it just concluded last week. So I don't know about attendance there, but I am hoping, since that was also in a virtual format, those that couldn't complete the retreat training that was originally scheduled for the Houma Thibodeau area will be able to participate in the one that happened last week. They also have been presenting at different conferences throughout the quarter. As part of their contract, we had talked about going to different national conferences where they can talk about this particular initiative. And they have gone, well, they went to the Governor's Office of Disability Affairs in July and presented at that conference. They also have a conference coming up this month. It's going to be the American Public Health Association conference. And then they were also accepted to present at the Association of University Centers on Disabilities in November. But as mentioned, this initiative, it has concluded. It will not be in our fiscal year 22 plan, or I should say it's not in the plan because the plan is active. And so any questions about that particular initiative? I don't think so. Okay. Oh, I was going to say, we did see some impact as far as attendance. In previous years, we had a lot more that showed up, only 144 participants this year. And I think a lot of that had to do with COVID. just because in previous years, we saw a lot more attendance, especially with our self-advocates, because they were actually able to go to where they may have been at during the day. They went into various group homes, they went into various voc rehab areas and be able to meet them where they were. And so bringing it to this virtual format, I think while it was able to serve a purpose for some people, it just wasn't as convenient for others. And I think they preferred a more in-person experience. I also think having done these trainings across the state over the last 2 years, it was inevitable that we'd probably see maybe a little bit of drop off because those that were interested in the training have probably already attended. But I'm not sure if that contractor plans on continuing with these trainings on their own. I know they were doing these before we contracted with them, but if it's something you're still interested in, you can always monitor team dynamics. I know they have a strong presence on Facebook. They also have a website, and you can see any events that they might have coming up where they might continue some of these trainings in a different format or a different source. So I'll turn it back over to Kim since I don't see any questions.
Thank you, Brenton. I'm going to move on to announcements now. Please note the council meeting is this week on Thursday. We have 3 committee meetings happening this Wednesday, October 20th. The Education Committee is at 8:30 a.m., followed by Act 378 at 1 p.m., and then the Executive Committee will meet at 3 p.m. Full council is Thursday, October 21st, and it begins at 8:30 in the morning. If you've not done so, please go to the council's website to register for the meetings. Does anyone on this committee have any announcements to make? Okay, well, I want to thank Mike Billings for all of his service he's done on the council and for chairing this committee. I'm not quite sure how many years you chaired it, but you did a phenomenal job. We know we'll see you Thursday, but then I believe that's your last council meeting. And I just want to tell you, you're going to be missed, sorely missed here. So thank you, Mike. So hearing no more announcements, if there are no objections, we can adjourn the meeting by unanimous consent. Any objections? I hereby adjourn the meeting at 12:13. See y'all Thursday, guys.